All right, everybody, it is 1 o'clock Mountain Time, and by my clock, that means it is time for us to get started. I want to kick us off with just a couple of quick introductions, make sure everyone knows what's going to happen today, and then I'll get us started on the program. So we'll go ahead and dive into that right now. Hello, everybody. Thank you so much for being here today, and welcome to Scientists in Action, a special edition of this program entitled Combating COVID-19. My name is Talia. I'm the Virtual Experiences Coordinator at the Denver Museum of Nature and Science, and my job today is to be your host and moderator. So that means I'm going to be facilitating Q&A between all of you and our two experts from Colorado State University, Dr. John Volckens and Dr. Sheryl Magzamen. They're going to be talking to you today all about public health, engineering, the effort to combat COVID-19, how we're studying the virus, how we're learning what sort of things keep us safe, and all the things that they've been working on. So we'll introduce them in just a few moments. We'll get to hear from them a little bit more in depth, but just a couple of quick housekeeping items before we get going. Before we begin, I want to respectfully acknowledge that today the Denver Museum of Nature and Science is broadcasting from the traditional lands of the Cheyenne, Ute, Arapaho, and Osheti-Shukoa nations, as well as other traditional keepers, and that Colorado State University, which is where our two experts work, is located on the same land. So we like to acknowledge those who came before us and stewarded the land in the generations before we were here to enjoy it. And so we wanted to give that little shout out at the top of our event today. I also want to acknowledge that we are currently connected to students from all across Colorado and even from across the United States. So if you haven't already done so, take a moment to type in the chat and say hi. Let us know where you're watching from today, how many students you have with you and their ages or grades, or if you're a student watching from somewhere other than your classroom, you can tell us the same information. So tell us where you're watching from, tell us how old you are or what grade you're in or about to be in. We know that some of you are watching from schools that have already started. Some of you are watching with family, and that's cool too. We want to know a little bit about you. And because you know what, it's not all serious science, folks, tell us your favorite pizza topping too. That chat is where you're going to be popping all of your questions, all of your comments. So find that chat now and say hi. I will be watching throughout the entire program today, and we'll be able to pull your questions at designated times to ask our two experts. So get comfy using that chat. We're not people on a recording. We are real life human beings who are watching and reading along. So hi to Katie's students who are just chiming in. Hi to Josie, who's watching in Montana. Hi to Carissa, watching from Westminster Public Schools. Great to have you on with us. Hi to Karen. See, we are seeing those names in the chat, and you can send those messages only to panelists, or you can choose all panelists and attendees if you want to say hi to everybody. I do just want to give a word of advice to our students. Remember that you are representing your school today, and that there are lots of different students and families and homeschools and groups on with you today. So please make sure you use respectful language in that chat, and let's think like scientists today, folks. All right, it is my distinct pleasure to introduce our two experts who are on with us today. I'm going to have them start their video now. We are going to have on with us today Dr. Sheryl Magzamen and Dr. John Volckens. They work for Colorado State University up in Fort Collins, and they're going to tell us a little bit about the work today that they are doing to help us understand and fight COVID-19, the coronavirus pandemic that all of us have been dealing with and having to rearrange our lives for these last several months. So first up today, we're going to hear from Dr. Magzamen, from Sheryl. She's going to tell us a little bit about what it means to be an epidemiologist. So I'm going to stop my video, and Dr. Volckens is going to stop his as well. We just wanted to give you a little wave and say, hey. She's going to kick us off with her presentation and put those comments and questions in the chat. You're going to get to ask those questions or hear her answers in just a little bit. Put them in there throughout her presentation. And thanks so much for being here, everybody. Dr. Magzamen, how are you?
Good. Thanks for having us, Talia. So excited to be here. And I'm coming to you live from my kitchen in Fort Collins, Colorado, which is where I do most of my work these days. Okay, so today I'm going to talk about what is epidemiology, because it's really helping us figure out this mystery of this new virus, COVID-19. So doctors and nurses and physician assistants, these are the people you would visit in an office if you're sick or hurt. And these are all medical professionals. They listen to you, they may prescribe some medicine or rest based on how you feel, what your temperature is, or what the color of your throat is. So medical professionals treat one person at a time. Epidemiologists, like me, are public health professionals. Our job is to treat the entire population. We don't do this by prescribing you medication or giving you a shot. We take information from doctors' offices, or clinics or hospitals, and sometimes even questions we might ask you at school or ask your parents at work, and put all of these millions of pieces of information together to tell a story about who gets sick and who doesn't get sick. We put information together for things like asthma, flu, dog bites, allergies, heart disease, broken arms, bicycle crashes, and really hard diseases like cancer, and try to figure out where these things happen, when they happen, and who they happen to. Some people call us disease detectives. So we take information on who gets sick and when and where they get the disease and try to figure out how and why people get sick. We use information about health like with other information, like what the air quality is like, what types of weather people are experiencing, or who gets to visit the doctor, and use this information to help tell our story. And we tell our story with math using things like tables and figures and maps. The reason we do this is because in public health, we're interested in prevention. Rather than treat people who are sick, the goal of epidemiologists is to do scientific research that helps prevent disease so people don't get sick in the first place. All right, so now that we know what epidemiology is, we're going to talk about infectious diseases. So there are lots of different types of diseases that people have. One of the diseases I study is asthma. So about 1 in 12 kids in the United States have asthma, so it's a really important disease to figure out. Asthma is what we call a chronic disease. So people get asthma generally because asthma runs in their family, which means that there's some kind of genetic component, but it's not always the case. You may have someone in your family with asthma, but other people in your family that don't. So chronic diseases like asthma are really, really complex. But the important thing about chronic diseases is that we don't catch it from other people. So asthma, for example, is not an infectious disease. Infectious diseases are things that are diseases that spread through something we call a biological agent. That could be this bacteria, which is staph, a virus, this is flu virus, or a parasite. And not just any bacteria, because some bacteria are actually good. Bacteria in our stomachs keep us healthy, actually, but some bacteria are not good for us. And these agents, or these bad bacteria, virus, and parasites are called pathogenic agents because pathogens make us sick. So everyone is probably familiar with some infectious diseases like the flu, which is caused by the influenza virus. And that's an infectious disease we deal with every year. Even a common cold that we get in the winter is caused by a virus. There's about 200 viruses that cause colds, some of which we haven't even identified yet. And parents, you may remember norovirus or hand, foot, and mouth outbreaks in your family's preschool days. We are trying to forget about those types of experiences in our house. So a big problem with infectious disease is that they're very easy to be spread by sick people. When we cough or sneeze or talk, we can spread our pathogens through the mucus and saliva we emit into the air. And yes, some infectious diseases are spread by pooping as well. So if we sneeze or cough into our hands, the pathogens can live in our hands. And then we touch things like desks or doorknobs or tables. These pathogens can live for a while on these surfaces. That means when we touch these surfaces, we can introduce pathogens into our bodies by doing things like touching our mouth or rubbing our eyes. The other way we can spread these pathogens is by sharing air with someone close by. So if we sneeze and don't cover our mouths and noses, the virus can be passed on through the mucus and saliva droplets that we spread through the air, especially if someone is going to be close by. All right, we're going to take a quick break from slides, and we're going to do a little bit of an experiment right now. So what I have here is some regular baking flour. So this flour is millions and millions and millions of tiny particles. How big are these particles? Well, they're really, really small. So most flour particles are about 10 to 300 micrometers. Oh my gosh, what's a micrometer? So well, look at this ruler. So we can see how big a centimeter is, and we know that there are 10 millimeters in a centimeter. And 1 millimeter contains 1,000 micrometers. So anywhere from 3 to 1,000 flour particles fit into a millimeter. These are just very, very tiny particles. So how fast is a sneeze? Well, we cough at about 50 miles per hour, which is about how fast a car might go on a slow highway. And we sneeze at about 100 miles per hour. And when we cough, we can spread about 3,000 particles. But when we have one sneeze, we can spread about 100,000 particles. So we're going to do a little experiment. I'm going to take my hairdryer, which shoots out probably a little faster than a cough, and show you how particles spread. Because we're going to do an experiment, I'm going to use a little bit of safety equipment. I can get over my glasses. And we're going to let this go. You ready? All right. Wow, I'm gonna have to clean up my kitchen later.
Why you need the face shield? That was, I even knew that this was going to happen, and that was a much larger poof of flour dust than I thought. So students, you can tell us in the chat what you thought of that too.
Whoa, I got flour all over the place. That was about a half a cup of flour, so not that much. So now there's this awesome cloud of flour that's all over my kitchen. So that's kind of what happens, like what happens when we sneeze or cough, except we can't see it as well as we can with the flour. All right, back to the slides. Oh my gosh, I have flour on my computer too.
I think that's just science right there.
It is, it's kitchen science, which is pretty awesome. All right, let me just get this slide up in a second. All right, so what is coronavirus? This virus that we've been hearing about so much in the news. Coronavirus is called coronavirus because of its shape. The spikes on the surface are like points on a crown, and corona is Latin for crown. Now let's get that back to all the flour in my kitchen for a second. Remember how big a flour particle is? Again, it's anywhere from about 10 micrometers to 300 micrometers. Now, do you want to know how big a virus particle is? It's about 60 to 140 nanometers. And what's a nanometer? So thinking about coronavirus, there's about one coronavirus particle is about 60 to 140 nanometers. And there's 1,000 nanometers in a micrometer. And we know there's 1,000 micrometers in a millimeter. So that means that there's 1,000,000 nanometers in a millimeter. These are very, very tiny particles. So that means about 100,000 COVID particles can fit into that millimeter on my ruler. Virus particles are so tiny, we can only see them with powerful microscopes. And when they're so tiny, we can breathe them in and they can go deep into our lungs and interfere with our ability to breathe. So how does coronavirus still make us sick? I think that's a question we all want to know. And scientists are still trying to figure out all the mechanisms, but we have some idea from other diseases. Once we breathe in coronavirus, some of the cells in our organs, especially our lungs, have a protein that allows a virus to enter the cell. The genetic code of this virus, these particles replicate or multiply in the cells. And our body doesn't really like this. Our bodies have a very strong stranger danger system, and that's our immune system. Our immune system is our body's response to fighting invaders that aren't supposed to be there. These cells are our immune system that try to fight off the virus. They act as a team to signal each other to respond to the invaders, or what's commonly called an infection. So what does this team look like? Well, it's a lot of different cells. So imagine it like a soccer team, and the soccer ball is the coronavirus. But the immune response is a very well orchestrated type of response. So think of it like an orchestra, where maybe you first have the horns, followed by the strings, followed by the woodwinds, followed by the drums that all act in concert to gather together to make this immune response that our body makes. We think that the high fever associated with coronavirus infection is the result of early cells called cytokines that work to fight off the infection. And we think that people get really sick and have trouble breathing from coronavirus because the air sacs in our lungs, called alveoli, that exchange carbon dioxide for fresh oxygen, do a worse job in air exchange when they're infected with coronavirus. All the spaces in the alveoli that are supposed to be filled up with air are filled up with all these old cells trying to fight off infection. And in some cases, the blood vessels that carry the fresh oxygen to our alveoli and take out the carbon dioxide also aren't working very well. So we're still trying to figure this out. Not all patients that have COVID infections have the same types of problems. So we are working hard on figuring out how the virus works. So this is the question that a lot of people are asking. Why do some people get really sick from coronavirus and some people don't? This is a research project I'm working on, and I'm learning a lot about the process. Here too, we don't have all the answers yet. We know that all types of people can get infected with COVID, but not everyone gets sick. Here's a few things we know about who gets sick with coronavirus. Remember, since we are epidemiologists, we don't look at one patient at a time. We look at the population and try to find trends and patterns. It doesn't mean that if you're a member of this group or someone that you love as a member of this group that they will get sick. But remember, understanding who gets sick helps us find solutions to prevent more people from getting sick. So we know right now people who tend to get sick when they are affected with coronavirus are older adults, men, more so than women, people of color, especially Black and Latinx community members, and people who have other diseases, especially kidney diseases or a group of diseases called metabolic syndrome. Why do these people get really sick from coronavirus? Well, we're still trying to figure that out. We think that some of these groups may be unhealthier in general, which makes our bodies It makes it harder for our bodies to fight infections. And that's one of the great things about being a kid, by the way. You are young and your bodies are strong and really good at fighting infection. Okay, so we want to hear from you. We're going to do a quick poll. So remember that epidemiology is about prevention. And one of the key goals of public health is prevention. We do preventive activities every day. So I want you all to think about what are the common activities that you can think of that prevent you from getting sick or hurt.
And I'm going to bring that poll up in just a moment. I'm realizing that it should have been put in as multiple choice, and I put it in as single choice. So I'm just making that change real fast to make sure everybody can vote properly. Looks like we're ready to go. Here we go. So students, you should now see a poll popping up on your screen. If you don't see it, I recommend opening up the chat or going to full screen. Sometimes that's what you need to do. We're asking you, what are some things that you can do or that you yourself do every day to keep yourself healthy? So select some of these things. What do you try and do every single day, or at least most days? I mean, there are some days where I eat a cupcake for breakfast, I'm not gonna lie. And maybe that's not a balanced diet, but cupcakes are delicious. So I go with it. Tell us a little bit about what you do. Do you brush your teeth every day? Hopefully you do. Do you eat a balanced diet? Do you get enough sleep? Do you move your body? Do you wear a helmet when you ride your bike or play sports like baseball and softball, or maybe if you ride a horse or something like that? Tell us a little bit about some of the things that you do. We'll leave this poll open for maybe 15 or 20 more seconds, so get those votes in quick. And then Dr. Magzamen is going to tell you why we're asking this. What's the whole point of talking about toothbrushing when we're talking about COVID-19? And I see one student in the chat saying, the only thing I don't do is wear a helmet when I bike. It's maybe a good idea. It's something you want to think about doing. Heads are squishier and brains are squishier than you think. All right, we have almost all those votes in. So I'm going to go ahead and end this poll and share the results. If you didn't get your votes in, you can tell us in the chat. All right, looks like just about everybody, somehow 109% of people, I don't know how that worked, voted for they brush their teeth every day. Almost everybody moves their body, eats a balanced diet, gets enough sleep. Fewer people voted that they wear a helmet. So what's the deal? Why are we asking about this stuff?
Okay, so COVID is all about prevention. And I just wanted, Talia and I wanted you to think about all the things you do that actually are about prevention every day. Brushing our teeth prevents cavities, right? Eating a balanced diet helps our immune system stay strong, as well as getting enough sleep. Moving our bodies also helps us stay fit and helps our immune system and our heart to stay strong. And wearing a helmet protects our brains. We invest a lot in our brains, so we want to make sure we protect it. So what are things we do for COVID prevention? So the first thing that we're going to talk about is washing your hands with any kind of soap. Soap dissolves the envelope of fat that holds the virus together and stops the virus from working. Think about all the things that you touch with your hands, including your face, your mouth, your eyes, your nose, hopefully not inside your nose. But remember that touching those shared surfaces and touching places on our face where the virus might be living, and not just coronavirus, but any virus, help us spread pathogens and spread infections. So wash your hands, 20 seconds, sing the happy birthday song, any kind of soap, any temperature of water, and you should be great. Second thing, wear a mask, and that's me wearing a mask. Wearing a mask is important because we, as a community, are a team. Remember when we talked about the particle viruses being very tiny? They are so tiny they can pass through the very small spaces in a mask. There are very special masks and face shields that medical professionals can wear to keep these tiny particles out, and Dr. Volckens will talk more about that. But the cloth mask that we wear when we are making sure that the particles do not travel out of our nose and mouth when we speak, sing, or sneeze, and our saliva and mucus does not travel in to share air. So wearing a mask might not 100% prevent you from inhaling particles, but we think they're pretty effective in making sure you don't spread your sneezing, coughing, or talking particles to other people. Plus, masks keep us from touching the parts of our face that we are likely to have virus particles we can spread. So back to being a team for a second. Viruses, despite not having a brain, are very, very smart. They have figured out how to live in our cells and make more of themselves. And the best way for us to fight viruses is not to give them the chance to make more of themselves in new people. So we protect our classrooms, our supermarkets, our doctor's office by not letting the virus spread. That takes all of us, not just a few of us, to commit to do this. So remember, if you're a soccer fan, Megan Rapinoe did not win the Women's World Cup by herself. And if you're a basketball fan, remember that LeBron James did not win an NBA championship by himself. It takes a team. And fighting a virus like coronavirus takes a team. It really takes all of us. These rules are especially important for kids because you're young and healthy. So if you get infected, you might not get the signs and symptoms that normally come with coronavirus infections in adults: fever, loss of smell or taste, or coughing and chills. So it's really important for us to take these precautions and not let other people get infected with the virus. Third thing, try to give people some space. This is what we call social distancing. Because we're trying to figure out how much of the virus floats around the air, because virus is so light and tiny, the air we share with people may have some virus floating around. If we give people space, still wearing masks and still washing our hands, we can take prevention one step further. And fourth thing, if you feel sick, stay at home. This is generally a good rule, but more than ever, super important. So I want to end by saying, friends, this is the hardest thing we've ever asked you to do. It is so hard not to do the things we love. It is hard not to go back to school. It is hard to wear a mask all the time. It's hard not to see our grandparents or our loved ones as much as we like. Scientists around the world, not only epidemiologists and exposure scientists, are all working together to fight this disease, which has impacted everyone around the world. Just remember that you too are part of this team. And thanks for listening.
Thank you so much, Dr. Magzamen. That's pretty amazing, all-encompassing information. And I do see a few questions that have come in for you. So if I may, I'd like to take a couple of minutes to direct those to you. We'll go for some quick questions, quick answers here. And then we need to hear from Dr. John Volckens, also from Colorado State University. He's an environmental engineer, and he's going to tell us a little bit about some of the testing that he and his teammates are doing on things like masks and other protective equipment, ventilators, and then how could the virus be spread by singing? What do we know about that? So we're going to hear about that in just a moment. One great question from Josie, and so maybe this will be our first one. We'll see how much time this takes us to get through. Since both the common flu, the regular flu or influenza, and COVID-19 are RNA viruses, why do we think that COVID-19 is more stable? So we've heard things about it's not really mutating, but the flu seems to have a different strain every year. What's the difference between those two things?
That's a great question, and we don't know enough about coronavirus right now to understand its stability. But Josie, I'm super impressed that you know that they're both RNA viruses. We've had a lot more experience fighting the flu, and there might be more strains of flu that we're fighting rather than the strain of coronavirus, which is COVID-2 that we're fighting right now. If you remember, there was another SARS, probably way back before you were born, in the early 2000s that was known as SARS or COVID-1. So some of the lessons that we're learning about current coronavirus come from the early lessons we learned about COVID-2. Science are still working on that, so great question, and hopefully get back to you soon on that.
Yeah, that's the hard part, is that a lot of the answers to a lot of these questions are still, I don't know, but we have to keep asking, and that's why we do things like this, so that we can get a chance. And then one more quick question, and then we will move on to Dr. Volckens. So does hand sanitizer really do anything?
Hand sanitizer has alcohol, and that helps to kill the germs. But remember, what soap does specifically is dissolve the layer of fat that keeps the virus intact. So hand sanitizer is great in a pinch, but if you can, be sure to use soap and wash with water.
Part of that important team in keeping that virus out of our bodies, but maybe not like the MVP of the season.
Well said.
All right, at this point, we are going to introduce our next expert. So I'm going to have Sheryl turn off her screen. Thank you so much, Dr. Magzamen. That was wonderful. At this point, it's my pleasure to introduce Dr. John Volckens, who's an environmental engineer, also with Colorado State University. Dr. Volckens, we already heard a little bit about some of the things that we can do, personal choices that we can make to help the virus not infect us, not help it not spread if we do happen to have it. Your work is focused a little bit more on some of the engineering and on some of the experiments that we're doing to make sure that our defenses are really the best they can possibly be. So what can you tell us about that?
You bet, and thanks so much, Talia. I'm so happy to be here. It's good to see so many people interested in this topic. Let me bring my slides up and share those. Okay. I'm John Volckens. I am a mechanical engineer and an environmental engineer and a public health engineer. I wear a lot of hats, but essentially I do the type of engineering that makes the world a safer place. And lots of engineering disciplines work to that effect. Let's start by talking a little bit about how you get COVID-19. COVID-19, like many cold viruses and flu viruses, can travel in the air you breathe. I love this picture because it's very, very gross. This is a picture of someone who is sneezing. Now, most sneezes aren't this messy. This person probably drank some water and kept it in their mouth right before they sneezed. And then they use a very powerful flashlight so that you can illuminate those drops when they come out of the body. But as Sheryl said before, when you do sneeze, you do produce thousands, hundreds of thousands of drops in the air. If those drops stick around in the air, you can breathe them in. And if you breathe them in, they get into your body. And if they get into your body and stay there and they have little COVID viruses in them, those viruses can make you sick. So how do you protect yourself from something like this crazy sneeze if it happens nearby? Well, of course, you wear a mask. This is a nurse wearing a specialized kind of medical mask called a respirator. Respirators and masks are essentially the same thing. A respirator is a fancy word for a mask designed to protect the wearer. Now, when we think about those particles that came out of the body, it turns out that your body is really effective at making particles of all sizes. What you're looking at here is that same ruler that Sheryl showed earlier, but now I'm showing particle size in micrometers, just like she talked about before. And so when we think about flour dust, we're thinking about particles that are around 100 micrometers in diameter. When you're reading a page in front of you, the dot above an I is about 400 microns in diameter. So we're even smaller, way smaller than the dot above an I on a newspaper or a printed page. Pollen that you see in the air and sometimes makes you sneeze certain times of year, that's around 10, 20 micrometers in diameter. When you think about sprays and fine mists, some of you might have asthma, and so this is an inhaler being pushed down, and that's the mist coming out of it. Those particles are around 1 micron. And then, of course, as we're experiencing Colorado, for those of you on the front range with me, we know we've got some wildfires nearby and there's smoke in the air. Those smoke particles are even smaller. They're around 0.1 microns or 100 nanometers. Very, very tiny. They're about actually the same size as this COVID-19 virus, which is just around 100 nanometers. The good news, though, is that if you wear a mask, it can prevent all of these particle sizes from getting past it and into your body. And that's why masks are so effective, because they filter out every single one of these particle sizes. What's interesting is that your body can make all those particle sizes too, either by sneezing, coughing, talking, even just breathing out. Some particles come out of your body. This is a quick video I want to show you that will illustrate how air moves around in a room. So engineers like to solve problems, but to solve problems, we have to study how the real world works. Now let me have a quick experiment. For those of you who are at home, put your arms in the air and just wave them back and forth as fast as you can for a couple seconds. You should be able to feel the air moving between your fingers as you move your hands so quickly. But you can't see that air, right? Well, this video is going to show you by coloring air in a room. And I'm going to show you what happens to air in a room just as someone moves and opens a door. So let's look. The door opens. You see two colors, but they're basically just representing air on each side of the door, and they move from one room to the next. And wow, look at all the air that just moved around. When you waved your hands a few seconds ago, you did the same thing in the room you were sitting in. You moved air everywhere. You can't see air moving around, but it is always moving in a room. Why is this important? Because if you sneeze into that room, you could imagine how quickly the particles will go everywhere. And if someone sneezes and they're sick with a virus like COVID-19, you could potentially inhale those particles in that room, which is why we have masks and rules like keeping away 6 feet or more from each other. I'm part of a respirator testing program at Colorado State University. I'm going to explain exactly what that is and show you some pictures of our lab. So a respirator, as I said before, is just a fancy word for a mask that's designed to protect the wearer. Turns out that the world nearly ran out of respirators in March, right as the COVID virus started to replicate all across the planet. People in every hospital, in every location were needing respirators to protect themselves, and we couldn't make enough quickly enough. Turns out the same thing was happening in the state of Colorado. We were running out of masks in Colorado, to the point on March 25th, the governor of Colorado declared an emergency and said, we are going to be buying masks. They're going to be showing up in Colorado soon, but we don't know how well those masks are going to work because we're not buying them from our regular places. And so the governor asked my lab to test all the masks that were coming into Colorado to make sure that they would be safe for people to wear and that they would protect people from COVID-19, especially for people like doctors and nurses who are working in hospitals around infected patients. The challenge, of course, is that the governor gave us only 1 week to come up with a plan on how to test masks. But that's where engineers really do shine, when we're given a challenge. This is a picture of my lab. It's the similar picture that I'm showing behind you in my screen today. It might look messy to you, and maybe it is, but that's because it's really a busy place. I asked my students and staff and collaborators to get out of the lab for a few minutes so I could take this picture, but normally there are people working in this lab on projects of all sorts. When the governor asked us to design a system to test masks, we went back to the basics and built an experiment so that we could test if masks were going to work the way they were intended. Now, you might think of engineering as all kinds of fancy math and computer modeling, and certainly there are those aspects, but a lot of it is actually arts and crafts. Here's my tape drawer. Do you have as much tape in your house? I love my tape drawer because you can do so many cool things with tape. Next to it's my glue drawer. Look at all the types of glue we have in my lab. Why? Because we're always coming up with ideas and taping and gluing them together to see if they'll work. We work with all kinds of tools and electronics. We also build our own circuit boards and test them. And of course, we have a 3D printer. We put all of this stuff to use so that we could test masks for the state as quickly as possible. So I'm going to show you how we figured that out. This is a picture of a respirator or a mask that you would wear to protect yourself from COVID-19. If you want to test how it works, the first thing you have to do is seal that mask to the top of a tube, because if it doesn't seal, then it won't work the way it's intended. Just like we want a mask to seal to your face, we figured out how to seal masks to tubes, and we did it using the simplest means as possible. Beeswax. That's right, the bees come to save us again. This is Christian Larange, a researcher who works with me, who is using beeswax to literally glue a respirator or mask down onto a plate. Once that respirator is sealed on the plate, we can pull air through it. And we do that in our chamber. What you're looking through is a glass see-through walled chamber where Christian is putting that mask onto a tube so he can pull air through it. Once you pull air through it, then we add particles into that chamber. We have a chamber so that it doesn't make a mess like Sheryl just did in her kitchen that we have to clean up every day, whereas the chamber can control and keep all the aerosol in one controlled place. But as we pull air through the mask, we figure out how many particles get through the mask, because that's how many particles would get through to your body if you were breathing through that mask. And of course, we hope the answer is none. This is a picture of the final experiment that we put together in 1 week's time. And yep, we use tape, we use glue, we use tubing, we use computers, we used all sorts of fancy equipment, and we were able to test masks for the governor and for the healthcare workers across Colorado. In fact, in the last 3 months, we have tested thousands of different masks for people. And the best ones, the ones that we know are safe, are used to protect the doctors, nurses, and healthcare workers across the state of Colorado. Now, we talked a little bit earlier about particles coming out of the body. And I said, of course, when you sneeze, you generate a lot of particles. That's true when you cough. That's true when even you breathe. But what about when you sing? If talking and sneezing and coughing make particles, what about singing? Well, we started another experiment in my lab to figure out if people who would sing or play musical instruments might be at risk of transmitting the COVID virus to one another. Because we know there are so many people in the world who love to sing, who love to make music, and they're being prevented from doing it right now because there's a fear that you could get sick while doing it. What you're looking at here is a big box inside of a room where we do our musical science experiment. We actually invited performers and musicians to come play their instruments in this box, in this sealed environment, to see if particles were coming out of that equipment. We then have computers and all kinds of fancy measurement devices to see and measure those invisible particles that might come out of your body in time. And as we have our musicians and performers change what they do and either wear masks or don't wear masks, we can figure out what it is to be safe and what might be a risky behavior for being in the performing arts. I'm going to show you now a quick video actually that we're making with Rocky Mountain PBS to explain this study to the entire world. And I think Talia is going to show the video. So Talia, if you're ready and you want to pull up that video and show
Yes.
to her, that'd be great.
I can do that. And while I get that pulled up, students, I want you to type in the chat and tell us what you think. Do you think that musical instruments are part of the big spread of COVID-19? What do you think they do? Is it not a big deal? Tell us what you think. So I'm going to get that pulled up in just a moment. It might take me a second. All right, you should be seeing my screen now. And then
Understanding the respiratory part.
apologies, got to back it up. And here we go.
Sometimes I feel like a motherless child.
The performing arts, we've been told that we won't be able to go back on stage until there's a vaccine.
We're trying to, get answers to questions that performers really want to know. Can I do my art safely? We are trying to understand what the size and composition of aerosols that are released from the respiratory tract when people are singing, playing instruments, and talking. So essentially thinking about what are the types of aerosols that come out from either their mouth or from the bell of the instrument. The goal is to understand that because when we think about viruses that are spread through respiratory droplets or smaller respiratory particles, understanding the size and shape of those particles tells us something about their likelihood to carry the virus and transmit that virus to others.
We can't wait. We've already been 5 months without our jobs, without our livelihoods. I want this study to really open up eyes about how we can move forward.
We're testing them doing it with and without wearing a mask, and we're looking to integrate into our study things like bell covers on the instruments, and other types of technologies that might help reduce that. So I think one of the most interesting and important findings we hope to have from this is not just what are the emissions that come from playing instruments or from singing, but what can we do about that? Which would in turn mean something that we can do to lower that risk of transmission and think about how we can safely do performing arts activities in the world of COVID. Our study is being performed in a aerosol chamber that here at CSU, it's referred to as the simulated environmental testing.
And you know what, folks, in the interest of getting to questions and making sure that we have enough time to get through everyone's questions, I'm going to opt to pause the video at that point so that we can let Dr. Volckens finish up. But we will be sending a follow-up email after the program ends with this video linked in it. So you'll get to watch the last minute or so, but we do want to make sure we have plenty of time to take everyone's questions. So I'm going to go ahead and leave us on pause. Dr. Volckens, anything else?
I think I've said enough. I will say one of the most rewarding jobs about being an engineer is using your skills to help other people. And I feel like with these two projects, that's exactly what we're doing. And so this is a great way for engineers to help the world. And I just want everyone to know that there are many more engineers like me working on designing a safer environment for us under this COVID-19 pandemic that none of us are happy about.
Very good. All right, well, with that, I'm going to ask Dr. Magzamen to turn her video back on, and we're going to start to take some questions. We have just over 5 minutes left, but you know what? If we do this right, we can get through a ton of questions and get a chance to hear from a lot of the people who are wondering things about COVID-19 and some of the work that all of you are doing. So keep those questions coming in the chat. Again, we will pull as many as we have time for today. So if you have one, it's brewing and you haven't put it there yet, go ahead and type it in the chat. All right, so one of the questions that I saw come in a little bit earlier on in our program isn't COVID-19, the actual virus itself, the coronavirus particle itself, smaller than the holes in our masks? And I think both of you touched on that just a little bit. You know, Dr. Magzamen, you talked a lot about it's important for us to wear masks, even those cloth ones, when we go out and do things because it helps keep us safe and provide a barrier. And then Dr. Volckens, you, of course, have been talking a lot about the different kinds of masks and testing those things. So what do we know about the size of the virus particle compared to the size of the holes in the mask? I'll have Sheryl start with that one, or Dr. Magzamen start.
That's a great question, and they're very special types of masks. The ones, again, the cloth masks that we tend to wear in public tend to, remember, protect other people from our particles, but don't necessarily protect us from other people's particles. Dr. Volckens talked about very special masks called respirator, which need to be fit, and these filter out very, very tiny particles. And I'll let Dr. Volckens talk about his lab, where those respirators he's talking about specifically for medical professionals and other people who are frontline workers do protect them from inhaling other people's particles.
Yeah, so when you think about filtering, you typically think about taking a sieve, right, like a little shaker at the beach and sand falling through the holes. But a mask actually doesn't work like that, because in air, those tiny particles get bounced around by gas molecules. And so as they bounce around in air, they can actually hit the fibers of the mask and they will stick. And so the mask doesn't need to be or have holes as small as the particles themselves, because it's more effective at filtering those smaller particles. I'm going to send everyone after this talk today a video called The Magic of N95s that will explain all the science behind these masks and how these masks filter out particles of all sizes so that you can understand for yourself. It's a wonderful video and I'd love to share it.
Yeah, that's another one that we'll be sending out in our follow-up email that may come later today, may come tomorrow, kind of depends on how much time I have this afternoon, but you will get that information. Thank you for that. Other questions that I've seen coming in, or other themes around some people's questions and comments, do have to do with things like social distancing. So Dr. Magzamen, that was something you recommended, staying a little bit apart from each other when you can. I do see a question from Emily's group of students wondering, are we ever going to have to increase that distance to more than 6 feet? Do we know if we'll ever have to change that recommendation? Or I'll add on my own question here. A lot of us are getting ready to go back to school for the fall. Some of the people watching today are going back next week. Will we ever be able to shorten that distance that we have to stay apart? Because I know that can be hard to do sometimes.
It can definitely be hard, and it's a great question, Emily. So one of the things that we want to recommend is that no one of these strategies by itself is going to be completely effective. The key here, remember, is not only acting as a team, as a community, but doing all these things, keeping our hands washed, keeping our faces covered, making sure that we have some distance. And 6 feet is a recommendation. We do that because of basically the velocity of the particles that come out of our mouths and nose when we speak, or sing, or sneeze, or cough. So we want to make sure that everyone knows that we have to do these things together to keep us safe. No one strategy is 100% effective, but doing all the strategies together is the most effective thing that we know how to do right now.
That's a great question and a great answer. Shout out to Andrew Brown from Emily's group. That was the specific question that asked that one. So applause to you, Andrew Brown. That was a great question. Looking at some other ones, this may not be a question that either one of you can answer, but let's try it. And Sheryl or Dr. Magzamen, I think this one might be more for you. What do we know about the long-term impacts of COVID-19 and the prognosis for people who actually get the disease? Is it something we can fully recover from? Do we even know yet?
That's a great question, and that's where epidemiologists really come in handy. Because COVID-19 is so new, we've only really started getting infections that started in China in December. So at this point, we really don't know what the long-term effects of COVID are. But what epidemiologists would do is start something called a cohort. And what we would do is follow people over time, some who were affected, some who were not infected, maybe some people who were infected with different levels of severity, and follow them over time to see what happens, especially to their lungs. That's where we're really concerned about the infection and the long-term health effects of that. So maybe by the time we're ready, some of you will be ready to be epidemiologists or aerosol scientists and can help us out with these studies.
Yeah, that's true. We're going to need a lot of people to not only send us their data if they feel comfortable, but also help us study the virus. I love that. I have a great question from Michelle Hamilton's group, and then I think we may need to start to wrap it up. We're getting close to the end of our time. If we end up going just a couple minutes over time, we'll see if we do that, but we are coming a little bit close to the end. I do see this great question wondering, so there's always some level of risk, you know, whether we're going to the store, we're hanging out with friends, we're going to school, even if we're doing all of these things to sort of stay apart, spend time outside and reduce our risk, there's always a little bit of risk at everything that we're doing. So shouldn't everybody have to quarantine for 14 days? Or what are some things that we can do, especially as we're thinking about going back to school, to really make sure that that risk is as low as it can possibly be? I guess, John, do you want to take that one? Dr. Volckens,
Sure.
We've been giving a lot to Dr. Magzamen.
So risk of exposure is really the product of several things together. It's how long you're exposed, how intense that exposure is, how close you are to the risk. And then of course, how much time all of that takes place over. Because if you are exposed to someone in a room with COVID and you take one single breath, it's likely you're not going to get sick, right? But if you take 100 or 1,000 breaths and you're just a few inches away from their mouth, well, you've decreased the distance, but that means the exposure is more intense. You've been there for longer. Those sorts of things tend to increase your risk. And so going to a grocery store actually isn't the most risky thing you do, as long as you practice those basic protection measures like wearing a mask, keeping 6 feet away, and washing your hands. Outdoors, you have to worry much, much less about getting sick from anybody because the world has so much air in it that the COVID particles usually don't last very long and they get blown away by the wind.
Yeah, that's a little bit reassuring, right? So as long as we can do some of those things, our risk is going to be a little bit less. We are coming up on the end of our time, so I'm going to pose one final question to the both of you. I do apologize that we weren't able to get to all of the questions today. Keep asking those questions, and who knows, maybe we'll have to do something like this again in the future, especially as the science continues to evolve. We're learning a lot more every single day about this virus, so maybe we'll have to follow up. A lot of the people who are in this call with us today are teachers, are students who are getting ready to go back to school, or families who have maybe made a different choice about going back to school this year. What advice do you have for everybody, especially as they're preparing to have their life shift a little bit, you know, as we start to return to school in the fall, or as maybe we start to spend more time indoors? What advice do you have for everyone, both to reassure us and also to help us stay safe? Let's start with you, Dr. Volckens.
The science out there shows that masks are very effective. In our music study, we have some preliminary data. When you saw that professional singer singing in our aerosol chamber, we saw all sorts of particles coming out of her body. When she put a mask on and started singing, we didn't see any, which means that masks not only protect you from inhaling COVID, but if you are sick, they protect you from releasing it as well. And so wear a mask, you will be much happier for it.
Very good. I've got mine right here, so I'll just keep that one on me at all times, and hopefully it doesn't muffle me too much. Now, I'm in a closed room. I don't need to wear that right now. And then Dr. Magzamen, we might have lost you. You are frozen for, oh, yeah, looks like we lost her. But I know some of the advice that she was going to share just in those last couple of moments. Looks like her internet might have glitched. Oh, no. You know, her big advice today, her big takeaway is just all of those things that you can do. There's no one solution for COVID-19. There's no one thing that says you definitely won't get it if you do this, but doing all of those different things together is the best thing to do to make sure that you stay safe. And one big takeaway that I have, the big thing that I want everyone to know, is that we had these two experts talking to us today. They're both working really hard, not only on understanding this virus and this pandemic, but also helping develop new technologies, doing studies and things to help us stay safe, have the best defenses against this. And they're not the only ones. There are people across the country and across the world who are working on this. So if there's one thing that I want everybody in this program to take away today, it's that we have a lot of really smart people out there working hard to keep you safe. And with that, it is time for us to end our time together today. We actually went a few minutes over, so thanks to everybody for hanging on. Thank you so much for joining us for Scientists in Action Combating COVID-19. This is the first event for schools this year, but we have a whole bunch of events that are shortly going to be available for registration. So check our website, dmns.org/virtual. We have a whole bunch of classes that are available on demand if you want a virtual experience with your classroom or your homeschool pod or your family. And we also will have more of the Scientists in Action series open for registration, available very soon, including 2 more with Colorado State University. Thank you so much for being here today, everybody. It means a lot to me that you were here. Dr. Volckens, thank you. Dr. Magzamen, wherever you are, I know we lost you at the last minute. Thank you both for being here today. We'll talk to you soon. Stay curious, everybody. See you next time. Bye.